as you look back, there must have been a very significant, maybe the most important challenge that you faced in your time as a state health director. Tell us a little bit about what you think maybe your most important challenge was.
You know, we woke up one morning and discovered that we had really a huge deficit in our Medicaid program, primarily through our mental health side of our program. And that was our biggest challenge when I was the state health officer. The real problem with that, of course, was that had been my program, which I had oversight for as the deputy. So the problems that I discovered as secretary were ones, in many ways, that I had created as deputy. They were political problems because there was a growing need for mental health services. It was a fiscal problem because we had been blessed almost with 6 years of really good funding. That's when the economy was turning along, and now the economy was downturning. So there was fiscal pressures, new problems with the Medicaid program, primarily on mental health.
Wow. You've mentioned to me a major challenge that you faced during your term as state health director. What do you think what would be an example of the most really greatest challenges for you during your tenure, and how did you address that?
The biggest challenge during my tenure as state health commissioner was a result of the fact that I was appointed right before the recession hit in 2008. And that meant that year after year, the entire time I was state health commissioner, we were cutting the budget. In fact, we had 8 rounds of layoffs, 8. And each round of layoffs took months. And so it almost every single month that I was a state health commissioner, I was in the process of scaling back programs and laying people off. And that took a lot of energy, distracted us from the work we wanted to be doing to promote good health. It created problems within the department around the overall morale. So we had to pay a lot of attention to building morale. And it also meant that people needed certain kinds of creative skills to be able to deal with those challenges and still keep their eye on the ball about what were the key public health issues we needed to focus on. And I would say overall the team of people did an outstanding job, but it wasn't easy.
Officer, I want you to choose the toughest, biggest deal challenge as a state health officer. An event, emergency, something that really taxed your leadership skills. Talk about that.
Well, probably my confirmation. In some of the press coverage leading up, I said that tobacco control, reducing tobacco use, was going to be one of my top priorities. And the most powerful lobbyist in the state, in the legislature, was the tobacco industry rep, who also had other big accounts, Anheuser-Busch Beer, Monsanto Chemicals, so he was by far the most powerful. And he objected to taking that on and almost blocked my confirmation.
That'll tax your leadership. So let's talk about you as a leader. How does a leader confront that kind of situation?
Well, I work closely with the governor's office and with my sponsor, a state senator, for my confirmation, and worked through that and told them I would use a rational approach and not get too carried away, not try to move too fast, and use a science-based approach so that they realized I wasn't some kind of radical who must be stopped at the beginning. I was confirmed on the last day. They made me sweat.
Let me segue to challenges. In addition to this leadership achievement, what is the greatest challenge that you faced beyond that? Other things that so far that have got big and taken a lot of your time. What would you name as the biggest challenge?
Number one, by far, is human resources. And being able to understand what management skills are also important to have while focusing on being a leader, understanding how to delegate as well, and understanding how to motivate your staff, to incentivize those that are doing good and to hold accountable those that are not, all within a variety of political environments that exists, whether labor relations or a more conservative environment or more liberal, navigating all of that with a human resources system that sometimes has been overlooked over the years because it's easy to eliminate or not invest in when money gets tight, has been one of the bigger challenges that has required the steepest learning curve, and has oftentimes pushed me in terms of that emotional intelligence and being able to better assess, all right, so what's needed in this situation to navigate this barrier? How do we find the best in people to get the outcomes that we want?
Let's apply it. Remind us where you were state health officer and what years you served.
So I was the state health officer in Arkansas from 2005 to 2013.
And during that time, you had a lot of challenges and some
Yeah.
real doozies. So just drill down on one. What was the biggest challenge, biggest issue that you faced in that time?
Boy, that's a really tough question. It seemed like every day was a new challenge. I often said that it was the best job I ever had. Some days it was both the best and the worst day that I've ever had. So I don't know. I suppose that one of the biggest challenges was the challenge of demonstrating to the governor and to the legislature the importance of public health as its own agency. You may know that when I came as the state health officer, it was in the waning days of the Arkansas Department of Health. And it was the organization was slated for consolidation to become part of the Department of Health and Human Services. There was this well guy that was the director of what was the new Department of Health and Human Services, John Seelig, a terrific guy, wonderful career person, had primarily focused on children and Medicaid, and it was a huge agency. But what happened is that public health became one of 13 divisions within the new Health and Human Services area. And despite all of our great intentions, when the governor says, I need to have the top 3 issues for your agency, and if your agency contained health and 12 other things, sometimes it was competition to decide whether you'd even get one thing that would be mentioned as a health issue. And so, the idea was this we could save money by consolidating our health department with human services, and so why wouldn't we do that? Part of it was because I don't believe that people really understood the importance of health. And so it was a good intention, great people that were trying to make it work, but over a relatively short period of time, the legislature and our new governor decided it was time to reverse course, that health was too important to simply be buried in an umbrella agency that didn't have as its primary purpose protecting and improving the health of the public. And I remember when the governor, I talked with him and he said, it's just too important. You need to have a strong voice in supporting public health. I need to hear directly from you. It needn't be filtered. It's important enough that in our state, health is prominent as its own agency. That was a challenge, not just to me, but to public health overall. But we were able to convince the governor and the legislature in a way that was professional and respectful, but the importance of being our own agency. And that set then the stage for a number of things that I'm quite proud of, including the passage of a tobacco tax increase, which also at the same time occurred with the passage of legislation that substantially created the trauma system for our state. We were, I think, among the last states in the country to have an organized trauma system. A trauma system that included not just the big city, of Little Rock, but all of our state. And I can't help but believe that that's one of the most lasting things that occurred was the creation of this system and the number of lives saved by essentially employing what we know about injury prevention and control. So a lot of things went on that I'm quite proud of. A lot of work went on by some very talented people. It was my privilege to have worked with and creating an important team, or groups of teams that worked on a lot of different projects. There were a number of challenges, but that's just one.